Are you one of the over 30 million people in the U.S. that suffer from dry eye disease?
If you're looking for an effective long-term solution beyond artificial tears, then we have the solution for you right here today.
We do. Joining us is optometrist Dr. April Jasper from Advanced Eye Care Specialist, located right here in South Florida. Welcome, doctor.
Thank you.
Thank you so much for being here this morning. Look, let's get started with the basics. I have the opposite. I have teary eyes. I mean, I tell you, I walk in.
I know you're always.
My eyes, depending on plants in a room, my eyes are always running. But what is dry eye?
Dry eye disease is a condition where you have tears that are evaporating, so you don't have enough tears in your eye, or you have poor quality tears. Poor quality tears would occur because you don't have the right amount of oil being secreted by the Meibomian glands. They are vertical glands that are in the bottom lid and in the upper lid. They open right behind the eyelashes and they secrete oil. And so every time you blink, your upper lid is touching the lower, pulling that oil film over top of your tears, holding those tears on your eye and giving you good quality tears and great vision.
Oh, no.
You learn something every day on this show.
No kidding.
So before we talk about this treatment, the Meibomian gland, I think it's MGD, right? Because
Yes.
it is a disease. I guess my first question would be, what should people look out for? What are the symptoms? And who's most affected by it, doctor?
So we heard of some of the symptoms. Watery eyes could be one of them, but also just a feeling of burning, itching, redness. All of those are symptoms as well, and that's why it can be so confusing for patients. But when you think about the patients that are most likely to have a problem, it is those patients that are on digital devices for a long period of time, or they wear contact lenses, or there's some medications that can cause issues, and sometimes just that lovely thing called aging, which none of us are doing.
None of us are doing that. No. Well, look, let's take a look at some of these interesting stats. 86% of people with dry eye cases are MGD related, but only 16% of the people, I guess, seek treatment. What are their options?
I think what happens is, in my experience, again, 30 years of doing this, is that patients just try to self-medicate. A lot of patients first reach for artificial tears. They go to the drugstore, they see this huge wall of drops, and they start to use them thinking that's all there is as an option.
And it's like every 2 hours, every 2 hours.
Yep. And the problem is it only relieves your symptoms for a few minutes. And so a lot of money is spent on it. They're not necessarily very effective. And so then they go to the doctor and say, maybe prescription drops are better. Then we'll prescribe a prescription drop for them. Our challenge there is more than 40% of patients on prescription eye drops stop taking them. And so then you go into what is another option that we have that we can do in office for patients to alleviate their symptoms and clear this problem. And that's where Tixel Eye comes into place. So
Tell us about it.
Yeah, what's wonderful about it is an FDA-cleared device that allows this thermomechanical action to actually go to the root cause of the problem, those Meibomian glands, and be able to help patients to go back to a normal secretion of oils, thereby helping them to have better eye comfort and alleviate their dry eye symptoms.
And can you imagine after all the drops and all the prescription drops, and now they finally get to Tixel Eye, what a difference, right?
Absolutely.
Doctor, thank you so much for sharing your expertise for us today. I learned so much.
Thank you. Thanks for having me.
Thank you. Meibomian, that's what we learned about.
There you go.
Now let's learn more from Dr. Lauren Bailey. She's a leading optometrist from Plano, Texas, specializing in dry eye treatment and aesthetics at West Plano Dry Eye and Aesthetics.
She'll show us how Tixel Eye is revolutionizing dry eye care, providing patients with a comfortable and effective way to achieve lasting relief.
Take a look.
We are a completely referral-based clinic, so our patients are coming in for relief for their redness, itchiness, dryness, discomfort, excessive tearing, vision loss due to ocular surface disease, and we're able to offer them other treatments besides just the regular over-the-counter drops, artificial tears, prescription medications, which are expensive and don't always work, other technologies with lights and lasers, heat packs, nothing's doing the trick. Tixel Eye is a new technology available to our patients that applies heat and pressure in a special way that rejuvenates the glands and helps them to move again. What sets Tixel Eye apart from other treatments is that you come to the office, you get your treatment, and you go home. We're not having to work as much with all these eye drops, lid scrubs, all this stuff you have to do at home over and over and over again. There are other treatments available like IPL and RF Tixel eye is different in that it's a quicker treatment, it's more tolerable, it's safe for all skin types. Patients enjoy the treatment, they have a faster turnaround on their dry eye, and it just works better.
And that was exactly the case for Tixel eye patient Jessie.
I tried IPL before Tixel procedure, and the IPL is a harsh laser, and they have to put metal shields in your eyes to shield you from that laser. It's very uncomfortable. Before I tried this Tixel procedure, I was getting dry eye such that I couldn't wear my contacts for an extended period of time, so I was only able to wear them for a few hours, and because of that, I wasn't able to work the way that I wanted and needed to. Dr. Bailey really explained that it's something that would help to open up my eyes and Meibomian glands and get everything flowing the way it should. And then after the Tixel, I'm able to wear my contacts for 8, 10, 12, up to 16 hours a day, which has been really great for me. And then on top of that, I was also getting ingrown eyelashes. And then because of using the Tixel, and now I have a whole full set of lashes that I haven't had since a teenager probably. And I was so happy and relieved to do it.
We deal a lot with patients who have had surgery, pre and post-op with cataract and LASIK surgery. A lot of our glaucoma patients are suffering with this as well. What makes Tixel eye work is the amount of heat and the amount of pressure that it requires for those oil glands to rejuvenate and move along again. Compared to other treatments, we just weren't getting the heat component that we needed to shock the oil glands like this one does. The Tixel eye procedure is very straightforward, very safe. We clean the area, we apply the pulses, 10 per eyelid. It feels warm, it feels gentle, and then you're done. It takes about 2 minutes. The first round of treatments, we do a series of 3 spaced 2 to 3 weeks apart. Now everybody's different. We might need more depending on the severity of your dry eye, but most of our patients take 3 treatments at the beginning. After that, we recommend a follow-up treatment at 6 and 12 months. Well, Tixel eye was originally discovered in the aesthetics industry. It was originated for the treatment of fine lines and wrinkles and festoons, but these people were getting their aesthetic treatment and saying, hey doc, my eyes are feeling better. And sure enough, the eye community investigated it, and the clinical studies show that it rejuvenates the oil glands. It helps us have a prolonged increase in our improvement of symptoms. The sustained effects of the heat treatments are happening for 6 months, 12 months. It's not just for a few hours. So there's a rejuvenation going on. There's more going on than just heat. So it's proven to be an excellent treatment for dry eye and wellness as well.
I started having dry eye symptoms at the age of 80. I'd never had those before. Gritty eyes, swollen eyelids, and they were sore, and I didn't know what the problem was. So I decided to go see my primary care physician. I was told that it was allergies. They said just take allergy medicine. I tried that and it didn't work. So I decided I'd go see Dr. Lauren Bailey. She introduced me to Tixel. I wasn't sure what Tixel was about, but it was a dry eye treatment that uses a heat source to open the eye glands. And after treatments with Dr. Lauren Bailey, my symptoms cleared up, and I decided to come back and do more treatments on that, and I've had no problem since then. I was very thankful to be able to just drive away from each treatment with no pain.
Don't let dry eye affect your quality of life. Visit Tixel.us/dry eye to learn more today.
And of course, as always, you can go to our website, thebalancing act.com. We'll see you next time, and thank you so much for being here.